I'm very pleased to have the opportunity to introduce Sarah Ramirez this morning. I first knew Sarah when she was teaching here at Cal Poly, and we experienced her sending her students out to the food bank in order to help us in nutrition education, in gleaning, and in teaching how to prepare meals from the food that we were distributing from the food bank. And then I kind of lost track of her, and when her name was announced as being chosen as the CEO of FoodLink in Tulare, I made no connection with that. And I would have known and probably understood when she was a professor here at Cal Poly that she has 2 master's degrees in public health, one from Arizona State and one from Columbia University, and that she has a doctorate in healthy and nutritional anthropology from Stanford University. But I would not have thought that to be the kind of preparation that you'd have for being the executive director, CEO of a food bank. But then I did a little research on her and found out that she is truly a daughter of agriculture. She grew up in a farm working family. She has experienced farm working herself, firsthand experience. She has applied that practical aspect of health and farming throughout her life and her education, and has dedicated, as she did when I first knew her, to getting people to learn about agriculture by getting their hands dirty, being involved in the community, and being aware of the connection between nutrition and health and the long-term resolution to poverty, which is the long-term resolution to hunger in our communities. So her background is very appropriate to being a food bank CEO, and I'm delighted to have her in the collegiality of food banks to lead us in our continuing efforts to bring health to the community and combat the root causes of hunger, which is poor nutrition and access to healthy food. So I'm going to let her tell you all about it. Sarah?
So thank you everyone for joining me this morning, giving me the opportunity to come and share some of our experiences. Thank you, Hunter, and Claire for the event, and Carl for the introduction. So I'm going to share this story, and hopefully it comes together well, because I have to share about 2 activities. One is the activity through Be Healthy Tulare that my husband and I began to undertake about 3 years ago. And when we really began to think about what we were going to do about food issues in our community. And then how that is now evolving into my new role at the food bank, and how potentially it might give us an opportunity to think about maybe the way in which food banks also need to adapt and change. So I hope that we have some time, because I do have discussion questions. My students will know me well, that I always like to talk about the various questions. So I'm going to start with telling you about my background. And I'm not a traditional food bank executive director, as you've already heard. My background is in public health. I have a degree in epidemiology. In fact, I was the county epidemiologist for Tulare County, the first one they'd ever had. And I am the daughter of farm workers, and I grew up in a community that is one of the most impoverished communities in Tulare County, which might shock you if you know that Tulare County is also the leading producer of ag in the state. #1 producer in 2014. Yet we're also the county that leads, unfortunately, in childhood poverty. The latest data that I looked at was 40% of the children under the age of 18 in Tulare County live in poverty. So I bring all this knowledge with me and into the work that we're doing. And so rather than starting off with boring data, I'm going to introduce some of my cute kids that work with us. And you'll hear a little bit about the kids and the work that we do in the community, and that's really informing what we're doing in Tulare County and also what I'm bringing to the food bank. So just pictures of us in action, including my husband, whom I could not do this work without. And I need to also tell people that I'm not a farmer. I like to have fun in the mud, in the dirt. This was the day we were building an outdoor oven in our garden. I love to cook. I love to share the experiences with our young people, and both in the classroom, out of the classroom, in the farm, in the kitchen, wherever I get the opportunities. But as I mentioned, my background is in public health, and specifically what I'm looking at are the social, cultural, and economic determinants of health. And these are the underlying factors that contribute to poor health outcomes. And as you see in this half-moon image, agriculture and food production is one of these areas. And when we're thinking about that in terms of a socioeconomic and cultural determinant, it is forcing us to look at whether or not there are sufficient resources to meet the daily needs of our residents. That's housing, food markets, having food and being able to get food, something which sounds so simple and yet can be such a challenge in some of our communities. So my experiences back home is that I tend to look at data like this. I look at health outcomes, and I look at health factors that contribute to those outcomes. This is actually recent data, 2015 data from the County Health Rankings, project of the Robert Wood Johnson Foundation, where they actually attempt to rank the health outcomes of a county. They do this for every county in the country. And as you can see right here where we've got Tulare County, put a little star so you can see where we're at on the map. We're really in the middle of the state and among some of the darker regions. So this darker color means that our health is faring worse. So when we're talking about health outcomes, obesity, premature mortality, accidents, whatever those health outcomes, when we start talking about health factors, these are the underlying causes: education, poverty levels, access to food, and as you can see on this map, Tulare County in health factors ranks 56 out of 57. So really, we're near the bottom. Now, these are the experiences I grew up with. Also, while I was away in school, in fact, in graduate school, this is clippings that I received from a faculty member while I was at Columbia in 2004. And they said, "Isn't this where you're from?" And what had happened was that there had been an instance of a young woman in a family who'd become blind due to her diabetes, and sort of had cultivated this awareness among the community that, wow, we have these cases of childhood diabetes in this community. We have challenges getting access to healthy food. We have increasing numbers of obesity. And my professor sent it to me and said, "This is the area that you're from, right? What can you tell me about this?" And it was really challenging for me to talk about the experience because I had grown up in a family of farm workers, and I had watched and seen my family members die at really early ages as a result of preventable chronic diseases, whether that is a diabetes or heart disease or even certain types of cancer. And these, as I started to look at the data, I realized that it actually supported the anecdotal sort of experiences that I had had growing up in my hometown and in my region, and watched my community members and my family members suffer and in some cases die. And it just felt like there was something that needed to be done. So after I finished at Columbia with my degree in epidemiology, I came home. And I began to look at data in different ways. This is actually not Tulare County. This is Los Angeles. But the reason that I use it is because it's doing exactly what I was just talking about, beginning to look at sort of the relationship between poverty and low income status and obesity and other types of health outcomes. And so if you can see on the map, these areas that are darker in orange are also the ones that experience the most economic hardship. Yet, you also see that they also have the highest proportion of childhood obesity in those parts of the region. So I look at Tulare County a lot, and I look at it in comparison to the Central Valley, San Joaquin Valley, and the rest of California. And as you can see, some of the data are really scary here. Here's Tulare County, where 62.6% in 2009 of teens and adults were overweight or obese. Some of the data that I'm looking at now are showing that that's more like 3/4 of the population. But what you can see here is that it's higher in Tulare County than it is in the San Joaquin Valley or California. So I can also look at issues like the socioeconomic indicators. We can talk about fair food and access to food and changing corner store markets and changing the access to organic produce, but who's going to have access in my community when we're talking about median household incomes that are below $25,000 a year? This is actually, these first two marks are actually my hometown of Pixley, mine and my husband's. Not only did we grow up here, we actually chose to move back to our community. Total percentage of children living in poverty is over 50% of the children in our hometown. And this is a hometown of about 3,600 people. You know, in some other communities, you have a very high proportion of individuals with less than a high school education. This is almost 80% here in the city of Cutler. Now, these numbers in red are very different from what we might see from those circled in green. So the city of Visalia, the median household income is almost $58,000, right? And yet, 25 miles away in Pixley, we're at less than 24,000. 20% of the children in poverty in Visalia live in poverty, but more than half in Pixley. And less than a high school education in Visalia, it's about 20% of the population. Very different from what we might experience in the smaller and more remote towns. You know, other issues that people don't think about are the challenges in small communities, the geographic isolation. You know, so we don't have a good and strong transportation network. And that'll come up as I keep going and talking about food deserts and other areas. So as the county epidemiologist, one of the things I did is I analyzed the data for my county, particularly looking at death, premature death, and life expectancy. And so these are some of the numbers that I was looking at. There's areas in my county where your life expectancy is over 80 years. It's 84 years. Yet there are other areas in my county in this darker red where the life expectancy is 69 years. That's a 15-year difference from living in one part of the county to another part of the county. And so I was looking at what is it about this that creates that difference. I actually took this data out into the community and asked them for their input. Why do we see such a big difference? You know, and so the question came up about high school education, families in poverty. You know, could it be that you just have an older population where you're seeing the higher rates of death? And the reality was that the difference in the older population wasn't that big between the two census tracts I was comparing. But what was different, substantially different, is the high school education and the poverty levels. So just for example, down here in Porterville, 32.8% in poverty, families in poverty, compared to 12.6% families in poverty. Food insecurity. So here we get into the issue, we begin to talk about hunger. Here we are in communities, agriculturally rich. What does food insecurity mean, and what does that look like for Tulare County? So in Tulare County, we know that 1 in 3 children in Tulare County, and just about the same in adults, 37% of adults live in a food insecure home. So what does it mean to be food insecure? There's actually 2 definitions of food insecurity. There's low food security and very low food security. So low food security means that there's reduced quality and variety of your food, but there's little to no indication of reduced food intake. When we begin to talk about very low food security, we begin to talk about those individuals who have disrupted eating patterns and reduced food intake, or now experiencing hunger. One of the questions that some of us have been asking is, does that label, food insecurity, do more harm than good? Is it hiding what we call hunger from our minds, from the visibility? You know, what have we done by moving away from the term hunger? And have we put it in a category that we're in denial? Or is this actually a category that is useful and helpful? Food deserts. So you heard a little bit about food swamps, right? Which is where you have a proliferation of unhealthy food resources in your community. But a food desert is slightly different. And there's questions about whether or not we should even be calling these food deserts, because obviously we've had nomadic peoples and indigenous peoples surviving off of desert life. So there's a challenge to the term, but I'll use it because it's what we're using still today. And so it's conceptualized as an area with limited access to affordable and nutritious food, particularly in low-income areas. So there's 2 pieces of this. According to the USDA, a food desert is a low-income area, low-income census tract, where a substantial number or a proportion of your residents also has low access. So the 2 have to be met, low income and low access. So let's go back to Tulare County. Let me show you what this looks like for us. According to the USDA data, we have 14 census tracts in Tulare County that are defined as food deserts. And in one of those census tracts, as many as 34% of the children, ages 0 to 17 years, so under the age of 18, live in one of these low-access communities. Okay, so I give you this background, not to bore you, but to tell you about some of the motivation behind the work that my husband and I have been undertaking for the last few years. We began Be Healthy Tulare because it is a project of love. Love for our homes, love for our community, love for food, love for education, you name it, it's a project born out of love. Our mission is to nourish healthy minds and healthy bodies for a thriving Tulare County. How do we make that possible when I just described the conditions that we live in? Our goal is to cultivate hope and dignity, to foster cooperation among the generations for a more resilient and sustainable and healthy community. Now, we believe all of these pieces are critical to what we're doing. We have young people in our communities who have lost hope at a very young age. We have to deal with the realities of gangs, drugs, family imprisonments. We have young people that don't believe that they'll go to college, and there are no alternatives for us. So my husband and I packed up our home, in Visalia and decided to move back home to Pixley to be the role models and to begin to foster that change. I'll talk about our biggest project, which is the gleaning project, in a bit. But let me tell you about our garden project. So we wanted to inspire and support and educate our community by deepening our relationship to food. We're all here for that. That's what we want. But we wanted to do it again in a way that cultivated dignity, in a way that allowed people to share in their experience. We have a lot of people who have informal educations, life educations. They don't have the degrees and credentials. We wanted them to feel that they had something to share with us, and they could do so and be respected for their knowledge. We even had a joke early on. We wanted to build an outdoor oven, and I had one family member who said, "Oh, I can make it estilo Zacatecas, and I can make it estilo this, other region, Durango." And I said, "You know what? I don't care what region it comes from. If we end up with 3 different outdoor ovens, we can have competitions, and then we'll figure out which one's the best one. Just get me an oven down here," right? We wanted everyone in our community to feel a part of the garden and to feel like they had something to offer, and to also validate with dignity our cultural food traditions, both in what we grow with our knowledge and how we prepare it. So it was a very cooperative and participatory effort. These are actually images that our children put together. And it's very interesting to live in a community where most of the residents work in agriculture, because some people make the incorrect assumption that that means that everyone knows how to grow food, and that hasn't been the case. So the young people, when I gave them a map to the property, which is about half an acre, I said, "What do you want to put out here?" They didn't really know what the options were. I laid out packages of seeds for them, and I laid out pictures of trees, and I said, "Just tell me what you think we should grow and where we should put it." We got a lot of requests. Like I said, our community is very poor. There isn't a lot of infrastructure. So you'll see in some of these that we got requested a basketball court, swing sets, an art and a dance studio, and my favorite of all is the penguin house. I think he meant, and granted at the time he was only 4, I think he meant maybe an igloo. So we're going to try to have a mural of an igloo at some point in the garden. We also, our first season growing, we also had the experience, and I think David was the one that noticed it first, where he had adults saying, "I don't know if this is ready to harvest." This is zucchini, which we know we can pretty much harvest anytime. And we realized that we're working with community residents who work in ag, but they know how to follow instructions. They're told clear a field, and they can do it. They're not necessarily having that knowledge, especially the younger generations, of the growing patterns and growing seasons. They know how to do their job, which is pick this field completely, and don't damage the fruit. But having the actual skill to know about growing is a different skill. We believe that our garden can be a garden for health and for cultivating a healthier food system. We actually took some of our community residents up to tour some of the gardens in the Bay Area. And some of our very first events, we had food, potluck style out in our garden. We also feel that it's a space to build community, again, following the models of some of our permaculture friends, following models of urban farms, even in Mexico City, Huerto Romita. And giving everyone an opportunity to contribute in some way to our garden has been important to us. Given the conditions that I described in my community, I think it's also important to talk about how that community building aspect of our garden is also a form of crime prevention. We've been very lucky. We get asked sometimes, well, have you had any vandalism? Has anything been stolen from your garden? And I don't know, I don't have an answer for why that hasn't happened. I'm really grateful that it hasn't happened. But I think that it's because we've involved the community in the way that we have. And it's also a very centralized location in our community. We actually now have our first four-way stop right by it, which took years to actually get. But it really is this idea of creating spaces where there's eyes on the street. We thought it was funny to add this picture because this is actually one of the deputies breaking rocks to build our spiral garden. We also think about what are different alternative ways to grow. What are the media in which we can grow? I'll talk a little bit about some of the other challenges that we're having when I get to the food bank portion of this, but we look at other models. Can we create value-added products? Can we encourage cottage foods in our community where we have such high rates of poverty? Is this a way for them to support and supplement their income when they're not working? So where we began was this is what our lot looked like. Lots of tumbleweeds, very alkaline soil. Community members who came together and very much like town hall style gave us their input of what they wanted to do. And this is what we've been doing with it. Growing food, building the health of the soil, involving people of all ages to participate. Our gleaning project is really also a grassroots effort to raise awareness on food waste and food insecurity. So we're harvesting, we're providing education, we're providing connection. At the same time that we talk about the fact that food should be feeding people, not filling the landfills. And what we know from the research is that as much as 40% of food that is produced, grown in the U.S. gets wasted. And most landfills are showing that about a quarter of the landfill is comprised of food, so 21%. And food waste is happening at every sector of the food system, in production, in processing, in packaging, distribution, and at the consumer end. Every sector of food system has waste. So one of the exciting pieces, and it's kind of evolving into having a life of its own, is we started working with one of the high schools last year, and they created this campaign. And in a way, they're our volunteer and outreach campaign called Harvesting Hope. And they're the teens that come out to glean with us when we go out into the fields or into backyards. And they've been really excited to grow and to grow across the schools. We do it because we help our community residents. We get to know them. A lot of the people whose backyards we collect fruit from are actually seniors or disabled. Sometimes they can't eat the fruit. They don't have enough family members. Or maybe in the case of grapefruits, it's contraindicated with their medications. We meet wonderful young people. These are the Alarcón brothers. And they're actually from the community of Porterville. And Renee here actually just started his first year, will be finishing up his first year at Cal State Monterey Bay. And he joined us for every weekend last season and brought his little brother along with him. And then when he gets to Monterey Bay, he decided to start his own gleaning project up there. So, we're encouraging leadership with the young people. They are telling their stories. So I love the fact that some of them are beginning to share their own stories, very heartfelt, very challenging, about hunger and food insecurity in their households. But I also love the experiences that we have while we're picking the fruit. And at the end of the day, I asked them to practice mindfulness. Smell. Can you smell how wonderful these lemons smell right now? Just take that in. Can you smell the oranges? Be grateful for that moment. We talk about gratitude a lot, and usually at the end of the day, and I say to them, aren't you grateful that you don't have to do this every day for a living? But doesn't this also make us grateful for the people who do? I had one young woman who just a month ago, at the end of one of our orange harvests, said she was going to go home and hug her mom because she finally realized how hard her mom worked. So we have all of these great experiences. And that particular weekend actually gave me a chance to talk about water and the drought, because right now Tulare County is horribly impacted by the drought. And so to talk to them about, hey, did you know it takes about 13 gallons to produce one orange? Let's estimate how many pounds of oranges we have here. How many oranges did we save? So therefore, how many gallons would have gone wasted if we hadn't picked the fruit? As I said, the group keeps growing. They do amazing things. Harvesting Hope just got recognized last week on the assembly floor by Assemblyman Assemblyman Devin Mathis. Devin Mathis. And who I just visited with a couple days ago. He'd probably be unhappy to know that I made that mistake. He has a picture, that exact picture actually, up on his wall. And we also had an opportunity to glean corn from the farm that the students, our ag farm, the high school ag farm itself. We brought in over 18,000 pounds of corn that the kids hand-picked themselves, and we brought it into the food bank. We bring family together across the generations. These are actually the Mendoza men, 3-year-old, Michael Paul, who's the advisor to Harvesting Hope at Mission Oak, and his dad, who actually comes out with his original wooden ladders from when he used to pick. He comes out with his own ladders. We glean in the fields sometimes. Right here, you'll see an image of my husband, our nephew, who's second year in college, and then the little nephew, who's only 3. So we get everyone to do a little bit of something. We did also family flicks at our garden this past year, and this was the vegetables we would put out after we'd picked them up from a farmer. This was his number 2 coals, and we would put them out as part of the event. We appreciate natural beauty, both in our food and in ourselves. And we continue to dream of having perhaps a farm stand on our little garden area and bringing in some revenue. And we dream that I won't have to abuse my husband's truck as much as I do. And I felt like this day was one of those moments where I saw the future. Look at this. His truck is full of vegetables that I had just picked up. Back here is the future mobile market. That's my goal. We have a cooking class. I won't say a whole lot about this, but our idea is really to think about closing that loop. We're growing the food, we're gleaning the food, we're going to cook the food, we're going to preserve the food, and share it in ways to bring people across together. So these are just images of some of the workshops that we've had, including traditional foods that might get thrown away, such as huitlacoche or corn smut. Very traditional dish in Mexico. And so part of what we're trying to do is cultivate and reconnect with our food traditions culturally as well. So now I'm switching over to my food bank hat. So I took over the food bank from our wonderful executive director who retired after almost 30 years of service. Took over that in the beginning of September. And September was also when FoodLink celebrated 36 years as being locally operated and serving Tulare County. And one of the reasons why our gleaning project had always worked with FoodLink for Tulare County was because FoodLink actually had sets of nutrition standards. Now, this isn't true of all food banks. I want you to keep that in mind. It isn't true of all food banks, but Tulare County really wanted to say, okay, we want to put out there 50% of what we put out there. We want it to be like super healthy, green, low fat, produce, 40%. Maybe, it's got a little bit of sugar, a little bit of fat, and 10% would be like the stuff that's a little bit less healthy or a lot less healthy, a little higher in fat and sugar. So I put this image of the whoa, slow, go, and because that was the idea. It's teaching moderation, right? And that moderation is also applied with what is distributed through FoodLink. And it was something I really appreciated about Sandy as the executive director at the time, that she had these standards. So many of you might not know how the food bank works, but food comes into the food bank through farms, through processors, retailers, gleaners, food drives, USDA comes into the food bank. It then gets disseminated out to a network of pantries and partner agencies such as schools or maybe churches. And then it's those partner agencies and pantries that actually have a chance to disseminate it out directly to clients. So this is how our model works in Tulare County. And one thing that I want to emphasize is that food system elements, the whole food system, can or does interact with the food bank in some way. Excess product from the farm might come into the food bank, or maybe a retailer, has items that are starting to get close to their expiration date, will clear them out to the food bank. So there's a variety of ways in which the food system and food bank are really closely aligned, I think. Let me tell you a little bit about what our food bank does. So we have 34 different pantries that we work with throughout Tulare County. And remember those data that I shared with you earlier about poverty rates and geographic isolation. So in 2014, our food bank distributed almost 7.5 million pounds of food. But let's look at these numbers. 2013, we served 103,000 families, and in 2014, 163,000 families. That's a 58% increase. And part of the reason we're seeing that is due to the drought. So our pantries programs, in our case, it's a lot of USDA product, shelf-stable product, rice, beans, oatmeals, those types of products, canned items. We also have a program we call Nutrition on the Go, which is very similar to our Healthy School Farmers Market. And what we do, we only have 10 of these sites. What we do is we actually take food, fresh fruit and vegetables out into sites, particularly those food desert and low-income communities where there is a need for increasing food access to healthier items. We combine that with tasters of various kinds. We have volunteers that really help us keep going. Really, the work of the food bank could not be done without our incredible volunteers at every level. As I mentioned, the drought. So Tulare County is one of the counties that's a recipient of the state drought distribution program. And these items, you see a picture here, canned carrots, canned meats. We've got some rice and beans, some dry milk, other items. It's about a 30-pound box of food that is disseminated in some of these communities, sometimes only once a month, sometimes twice a month. That's something I should say about our pantries. Sometimes we assume that all of these programs will go on and that are fully funded, but they actually, or that they are ongoing every day, and that isn't the case. In some of our communities, we have pantries only once a month. There is no way that the need can be met in our communities with a once-a-month service, yet that's all we can really do and manage. We have our summer food service and our Smart Packs, which is our weekend backpack for kids, where they receive a couple of lunch items, a couple of breakfast items, produce, and other items in their snacks. So here's where I want to talk about the sustainability piece or resilient pieces. Food pantries, we know, are being accessed more and more as a consistent supplemental food source. So this is research from Feeding America. So 54% of the people surveyed had used the food bank for 6 months or more in the past year. Right? So as you can see, just a little bit over a third of the people who are food bank and food pantry recipients are actually out there every month of the year. We also see that it changes by age group, and very sad to notice here that it's seniors, the 65 plus group, which are more likely to be the reoccurring users or the reoccurring participants of food banks and food pantries. So one of the questions that I'm asking myself, here's Be Healthy Tulare, here's all these wonderful projects we're trying to do, cultivate a healthier system. How do we bring that into the food bank, and is that even possible? How do we address hunger, nutrition, and obesity with some positive solutions? And given the current conditions, drought, which impacts production and economic status. As I mentioned, we had a 58% increase in just the last year of participants. Drought impacts, we already had unemployment challenges, underemployment, and seasonal employment, which are only worsening with the drought. We have high numbers of children below poverty. We have poor access and food deserts, and we have a growing aging population on fixed income. Now, given all of those conditions, how do we create a resilient food system to address the need so that everyone is able to access food adequately? And I'd like to mention this definition. So we heard a definition of food security earlier today, and I really want us to begin to challenge what that definition should be. So I want us to begin to think about food security as being a situation in which all community residents obtain safe, culturally acceptable, nutritionally adequate diet through a sustainable food system that maximizes community self-reliance and social justice. And I really am using this as trying to push where we go with FoodLink. So where we go with FoodLink, I want it to be where food builds health, skills, and community. So now you get to hear my manifesto. Here's my manifesto. So FoodLink will bring together families in low-income communities to grow, cook, share, and advocate for good food for all, while also working with the broader food movement to empower communities to create a healthier food system. This means eating together, increasing access together, cooking together, growing together, making change together, perhaps even leading our food policy council, of which Tulare County does not have one. So I'm designing our new facility thanks to a USDA rural development loan. I'm designing the new facility that was purchased with those monies for that future. These are renderings. This is not what our facility looks like. This is what I hope it will look like. I want us to change the conversation around hunger, teach enjoyable skills and reduce the isolation, promote respect and dignity, reduce the blame and shame experienced by those in poverty by linking daily challenges with systemic issues, and build the consensus that all people should have the opportunity to access good food for a healthy life. I'm designing the future to also include a garden space at our food bank, to increase our gardening knowledge, learn some transferable skills, again, reduce the isolation, celebrate diverse growing traditions, increase our fresh access to produce. And I hope that we also have a kitchen in this space so that we can do everything we'd like to do to build confidence and skills in the kitchen. All of this is intended to make sure that we understand how our personal food choices influences health and the food system widely. So these are my discussion or thought questions for you, and I think we're pretty much out of time, but I'm happy to stick around and hear your answers and have a discussion of this. But my question to all of you now is it possible to create a more sustainable food bank? And if so, in what ways can we make food banks more sustainable? Given that every sector of the food system intersects with our food banks, where in the food system might these changes need to take place? And can a model of the food bank, which is only 40 years old, be salvaged? Or are we talking about transforming and creating a new food bank model to take us into the future? So thank you.